When she came now, since 2021, she was suffering with the same mitral stenosis complaint. The cardiologist told they have to operate that time also. There is no option. Your mitral walls are, your walls are having calcium blocks are there on mitral wall, and they are heavy and they cannot open properly in full diameter. That time they are told, and they have started her diuretic. As that time she was suffering with swelling of the whole body, swelling. Even eyebrow and eye face was full swelling when she came to us. Whole body swelling. Dyspnea was very difficult. Even she cannot lifting the any objects from the simple hand. Also she was having breathlessness. So I cannot do anything. Such a breathlessness she was suffering. Breathlessness, dyspnea while breathing, dyspnea while only simple exertion also. While going from that to this room also exertion, the dyspnea was there. See how difficult pumping was there of the heart. Swelling, whole swelling, I will mark 3 plus swelling. 3 plus swelling on face, hands, legs, thigh, dropsical swelling was there. And swelling started in May 2024. After taking, she was on diuretics for last since 2021, but suddenly by taking those medicines also the symptoms again increase. There was no change again taking by those medicines also. Huh? Uh, huh. And that time the cardiologist also told us ki you have to do the operation. There is no option for, and no other medicine can recover you. No surgery will be necessary. Again, they visited us in 2024, June 2024. We suggested us do the proper current MRI, current 2D echo of the heart. Let us see what is the condition. Then we will decide which medicines will come, whatever the pathologies in heart are there, or what are the conditions are there. Then they gave the report. The cardiologist called us. Why you treating such types of cases? They called me, why you treating this is a surgical case, you need surgery, it will not work anything. You refer the case to the JJ hospitals or give, they are not affordable to pay for operation, they will see. Well, I am trying the case, if the symptoms can changes, anything can happen. Na? Let us try. Na? Then they told only 1 centimeter opening was there, we cannot inject the finger also from the mitral wall, this much narrow the wall has become, and thick calcium blobs on the atrial side, on vital wall, leaflets are there. It will not go, he told, it needs surgery. This is the cardiologist, he gave the reports. This was the previous 2D echo, in July she done. And again I repeated from the second cardiologist opinion also, let's see whatever the reports comes. Rheumatic heart wall disease was there. Severe mitral stenosis, left atria was enlarged, LV is, left ventricle is not dilated, mild tricuspid regurgitation, and mild pulmonary hypertension was there. These are the previous 2D echo reports. Again I in 16 I again done, let us confirm actually what is this. Then I did the 2D echo again, the same he told us. MVA was only 1 centimeter. See, MVA only 1 centimeter. The last line is mentioned. What are the present state I took in the case? Main heart was affected. Heart walls were affected. Heart walls. Breathlessness of the heart. Dyspnea on exertion is there. Swelling of the hand, face, legs, and knee, and weakness to work. Anything she would not she was not able to do anything. From this, which are the probable the medicines were coming, which are acting more on valvular heart disease or on the dropsical heart disease or rheumatic heart disease. Calica was there, Apis mellifica, Spongia, Spigelia, Rust ox, sulfur, Pulsatilla, carboric acid, Cactus, digitalis, then lachesis, phosphorus, and arsenic album. I have written the lines of the medicines, which are from the hearing guiding symptom, tight and white swelling of the whole body with a great painfulness of the at every touch. After the many weeks, when it goes off, becomes soft and passing anasarka. These are the symptom. Tight painful swelling of the first of the legs and then also of the hands and forearms, and only passing off slowly after several months, while pulse is no way retarded without increase of the flow of the urine. Indifference of lack of. These are from the proving lines of the Dr. Hughes. See, a sense of weight in the head and uneasiness in the heart whole day. Circulation, the most important circulation action of the digitalis is in the heart. Influence is exerted in two ways, through the vagus and by the direct action of the cardiac muscles. Okay, he is giving the in Richard Hughes the proved symptoms and poisoning symptom he has mentioned in this book. What of the process he done? Then it is serviceable in a cardiac dropsy. There may be the general anasarka. The patient cannot lie down or is obliged to sit up. In the dose sufficient to obtain the physiological action, it is often useful in a case where insufficiency of the heart is impaired, whether from the valvular heart disease or the debility, as in the anemia. The inefficiency of the circulation causes imperfect nutrition of the organ. This is the main cause, anemia and nutrition cause, including the innutritions of the heart itself, and allow the tissue become waterlogged and dropsies in the form. The direct stimulus given to the heart by digitalis and resulting improvement in the circulation enable the organ to resume all functions. Clear of the superfluous fluid by promoting diuresis, and above all the increase of the blood supply to the musculatures of the heart itself enabled it to recover its virgus. I give the medicine digitalis 0.1 potency, 10 strokes, 5 ml in 30 ml water, and drink all medicine 4 times a day for 10 days. This dose finishes in very 10 days only. It is 5 ml dose. After 10 days, she told me after 3 or 4 days my swelling started reducing, started reducing. Breathlessness was also reduced 40% than before. Only on exertion the breathlessness was there. So I continued the next medicine 0.2 potency, the previous medicine of finished. Same dose, 10 strokes, 5 ml and 30 ml, 60 ml water, and drink all medicines 4 times a day. After 13 days, when I saw her, the whole swelling was reduced. 13 days. When I had not taken the before, but on CCTV camera, the recording is there of her video. The whole, when she became very thin, hands and legs, she was become beautiful also because of our medicine action properly. I was not even do not identify her. So he is the patient or who is the patient. Such a swelling reduced in her body, and swelling was no dyspnea was there. Only weakness, mild in form was there, not completely. Then LM 0/3 after 10 days. Every 10 days I have to change the medicine. Only 10 days the medicine get finished. Same dose I gave him. Third follow up after 20 days. No breathlessness, no swelling, nothing is over there. Only at apex, the murmur, the sound was heard. When the blood flow from the atria to the ventricle, left ventricle, the sound was hearing. Then some still there obstruction is there, stenosis is there. The otherwise she was better, and she was working in the farm after 20 days. Only not lifting the heavy weights, but whatever the works she was doing in the farm, they used to cultivate the vegetables in the farm. They all were working with their families, and that time I advised to stop the medicine after 10 days. Yes, he was having swelling, so I do not stop this diuretics and all everything. I taper after 2 days. 2 days later, I told him to take the medicines. Then I stopped the medicine 20 days. I continue the other medicines of digitalis. Then again after 4th follow-up 10 days later, no breathlessness, no swelling was there. Same complaints. Again, I continue the LM3 digitalis in TDS for the 4 times a day it was. I continue for 3 times a day. As swelling was reduced, and see what. Now the time is there, we have to know which are the antiseptic medicines. We have to give the antiseptic medicines. Okay. The video is there. The later I gave him spigelia. Spigelia I gave, spigelia. Now she is on spigelia. I told us to in this week she will give the report to us. I will post it on Facebook. But generally 80-90% she is better. No breathlessness, only mild murmur is there when walking and when exertional murmur there. But otherwise ECG came normal. 2 day ago I will see in this week, and baki all symptoms are gone. Now at this time we should give antiseptic. Spigelia, the action is more on heart walls from crude medicine. In this also I have given the medicine name also. Apis, spongia also having more on valvular heart disease. Spongia. Then cactus also. These are the more nearest medicines. But we should go towards the antiseptic only. As vegetation is there and calcium blocks are there. They are very hard. And for this patient, what diet I said, I stopped her all subsidies. She was farmer, she was doing farming. So many times she was eating spinach and all everything, same diet she was eating from the farm only. They were not bringing the vegetable from the outside. Every time spinach only. So more oxalate and uric acid diet the patient was having. So I stopped all those. And more fruits and salad and gravy wala vegetables. After that the improvement started, and because of that the calcium block also can reduce.
I have a question. I have a legitimate question. We previously saw dengue hemorrhagic fever. We took all the symptoms. It is just of the dengue hemorrhagic fever, nothing of that patient. Here also the analysis shows that. So my question is, can we apply this to any congestive cardiac failure case? How will we differentiate another case of mitral valve stenosis or CCF comes? These symptoms will be there. So you can just apply this.
Yeah, you can apply also.
No, you are saying the common symptoms of this will be present in all the cases.
Yes.
But sometimes
yes.
swelling may be seen on the legs also, on the face also.
Variation is present.
Variation will be there.
Even in the common symptoms, there will be variations.
These are the group of the medicines which we see the symptom. Variable symptoms, variable medicines act. Kali is there.